Here's a list of 6 medications that could be contributing to the extra pounds. Now, many factors can contribute to weight gain, from overeating to limited physical activity, stress, and even poor sleep. But another culprit you may want to look into is prescribed medications. Here's a list of 6 medications that could be contributing to the extra pounds. Number 1 on our list is antidepressants. A common class of antidepressants called selective serotonin reuptake inhibitors, or SSRIs, may initially cause weight loss when you first start taking them. But if you stay on them for 6 to 12 months or more, you might actually begin gaining some weight. If you're on Celexa, Paxil, Lexapro, Zoloft, or any other SSRI and have put on a few pounds, this may be why. For the most part, antidepressants are thought to cause only relatively minor weight gain of less than 10 pounds per year. Suppose you're taking antidepressants for bipolar disorder. In that case, any weight gain that could be tied to medication is usually associated with metabolic changes. The next type of drug that may contribute to weight gain is antipsychotics. These drugs may be prescribed to treat psychosis or symptoms and conditions such as anxiety, depression, and stress. Because of their effects on your brain, antipsychotic medications can lead you to eat more high-calorie foods that can raise your risk for diabetes. Scientists estimate that nearly 80% of people who take antipsychotics can gain weight to the point that they end up as much as 20% higher than their ideal weight. Weight gain is more common with newer antipsychotic drugs than older ones. Olanzapine, which is sold under the brand name Zyprexa, is likely to cause more significant amounts of weight gain than older drugs like Risperdal or Invega. However, according to a 2018 meta-analysis, these two can also cause weight gain. Beta blockers are our third drug culprit that may be causing weight gain. Often prescribed to people with low blood pressure, beta blockers have been associated with limited amounts of weight gain during the first year of taking them. Usually, if you take these drugs for longer than a year, they don't cause further weight gain. While most people only gain about 2.5 pounds or less, some gain 10 or more. Beta blockers can cause fatigue, which may reduce your physical activity and thus contribute to weight gain. They also can affect your metabolism and cause your body to store excess fat around the abdomen. It's also important to note that the drugs can raise your risk for diabetes even if you don't gain weight. Number 4 on our list of drugs that may cause weight gain are HIV medications. These have been associated with both weight gain and changes in weight distribution. Many people who take them lose fatty tissue around their faces, arms, and legs, but gain fat around the abdomen. Some of the drugs are associated with insulin resistance, which is a big trigger for weight gain. Number 5 is anti-seizure drugs. Several anti-epileptic medications are thought to lead to increased body weight because they interact with the hormones that help you sense when you're hungry and full. They may slow your metabolism and raise your risk of insulin resistance and diabetes. Patients have reported that several anti-seizure drugs have contributed to weight gain. These include results from 71% of people on valproate and 43% of those on carbamazepine. You're most likely to gain weight within the first year that you're taking anti-seizure drugs. It's also more common for women or those who are already overweight before starting treatment. Our 6th and final medication that may contribute to weight gain is corticosteroids. This class of drugs is different from the more controversial anabolic steroids, which is a male hormone commonly used to build muscle. Corticosteroids like prednisone work with the stress hormone cortisol and are classified as anti-inflammatory drugs, often prescribed for autoimmune diseases like rheumatoid arthritis, lupus, or vasculitis, which is inflammation of the blood vessels. Although inhaled, corticosteroids and single injections are not associated with weight gain, long-term use at doses of more than 5 milligrams per day may cause weight gain in up to 70% of people who use them. About 20% of those who gain weight say they put on more than 20 pounds. The drugs are thought to increase appetite for unhealthy comfort foods. They may also slow your metabolism by interacting with your hypothalamus, a part of the brain that regulates many hormones. Additionally, corticosteroids may increase the amount of fat you store around your abdomen and increase insulin resistance. Now, if you're concerned about gaining weight and one of your medications is on the list, talk to your doctor to explore all the risks, benefits, priorities, and other potential options before considering any medicine changes. For more detailed information, visit our article link to learn more about what doctors have said about some of these medications and weight gain. If you enjoy learning from videos like these, feel free to like, share, and subscribe.